Need a motion to approve?
Motion approved. Second.
Second. All in favor?
Aye.
Opposed? Okay, Doc, you're up.
Okay, yes, our first resolution ask you approve is authorize budget modification and reclassify a position from typist to account clerk. And this is part of our departmental reorganization, and we will not request additional funding from the county and use current budget.
Can I ask a quick question on this, Jim?
Yeah, go ahead.
Yeah. Is this an individual that's changing titles, or you're hiring somebody new? Because you're actually giving them a pay cut here of about $1 an hour.
No, it's a change in the title. It's not hire a new.
So that's their present salary. That's the salary that you're hoping to pay them. So you've got somebody sitting there and you're going to change their salary.
No, I believe this is just a minimum salary.
Oh, okay.
Yes,
So there's not going to be any change.
No, not a current staff salary. No. This is just this as a usual rule.
You
And
see somebody wanting to take that and change it.
no. I will not treat the people that badly.
Okay, very good.
No.
Maybe a little bit.
Any other questions? Need a motion, please?
Motion?
Second. All in favor?
Aye.
Opposed? Motion carries.
Okay, the second resolution is money around to pay for mosquito spraying, and this is for the second time we spray, and we spray I think Hastings, Palomar, and Mexico, and this is about 12,000 acres, and this is, as you know, we're not putting into budget, and we need to get to pay for it.
Any questions?
Yeah, usually we get a grant from the state. Is that still in line?
No, it's not a grant, and I came here 2012 summer, and we sprayed since start, and we never got the state grant. And usually this is the way state put it is, if we spray and state-owned land, we can get a reimbursement from the state. It's not that they give us grant.
All right,
So, yes, this 12,000 acre, almost all county property, not the state property. So this time, probably county needed to pay for. And last time when we sprayed this this Big Bay area, swampy area, yes, a little more than half area is state property, so state pay for. And then addition to county and the state pay 50%, county pay 50%.
Are we testing other areas of the county, or are we just primarily targeting this area?
No, we follow state entomologist's suggestion and look at where disease active and where, because we are not just catch mosquito, we catch specific mosquito spread triple E. So we follow her instruction, and she say where to put it, where we put it. So it's not everywhere, but quite broad.
Are they testing everywhere though to see if the disease has traveled to other areas, or are they just primarily targeting this area of the county? Because it seems like we always go to the same spot every year.
Yes, because this area,
It's a big swamp.
because this
There's a
area,
lot of swamps.
because this area, this swamp is the place brewing this specific mosquito called marinola. So this is our target. It's not that we target all mosquito. We target this called marinola, this mosquito. It spread triple E. And also we, because this mosquito can fly as far as 15 miles.
Yeah.
So it's quite broad in the county, quite broad. And we're specific, and this every year slightly changes. As my communication with her most recently, and she said, next year I want to put a collecting box in this specific spot. This year we didn't collect. So we mostly follow her instruction, and she's well respected in the field. Yeah, she said where to put it, because honestly, we don't have this expertise. Other than we can collect it and we can sort it out, and like this kind of planning really mostly rely on her scientific knowledge. Yeah.
The people in the town of Albion.
Yeah.
There was one spot that you had a problem up there. It's gee, whereabouts? They'd like to know whereabouts in the town of Albion.
This we usually not release whereabout. Couple reasons there. Okay. The first reason is really we worry about vandalism. Some in the past, before I came here, it happened, and I knew your property county put a collecting box there, and I came to take it or destroy the box. This is one reason. The second reason is because this is not like immunizations. We can always put certain places, and as I said, every year when situation change, we may have some change. So we not make announcement and let people think, oh yeah, I'm safe, and I live next to Chanel, and her collecting box is always negative. I don't need to worry. Why? It's because mosquito, yes, no boundaries. So it's not means in her property I next to her without a mosquito, it's safe. This is another bigger reason. Yeah.
Good?
Good.
Okay.
We also don't want curiosity seekers wearing mosquito repellent to go out and try and find them. And mosquito repellent around the
Oh,
trail.
they're just curious.
Good?
Yep.
Need a motion? Motion,
Second.
second. All in favor? Opposed? Carries. Up again, Doc?
Yeah, and the third is early intervention. Early intervention. We needed to remove some money there, and the cost is unexpected, and this is a lot of. I want to blame the state side, and in the past, I think almost 3 years now, and my time sense is lost in COVID pandemic, and state changes their reimbursement system and make our prediction is very hard, and you know Nelson, and he's very experienced and a very careful worker, and always in the past very well estimate how much need, but this time state this reimbursement system is terrible.
So outside a conversation with Nelson, he said that the cost came roaring back after COVID a lot faster than anybody anticipated. So this budget bond takes money from within their own budget and gives them enough for the rest of the year.
Any questions? Need a motion?
Motion. Second.
Second. All in favor?
Aye.
Opposed?
The fourth resolution is ask you to give us 3 temporary positions for case investigators. They are temporary, they are part-time, and we talk about the last week, and in the middle of last week we had close to 300 cases stack up, and I got the emails, calls, and our phone bank got the angry calls, and why I tested positive and you never reached me. Why? My son contacted somebody positive and you reached me 5 days later. And it's complicated why so much delays. And I can number some, and one is now we have more testing provider, not like a previous, and many pharmacies they provided testing, but their testing, they did the testing and they not put their testing individual information testing results into the state system. This caused a bigger delay, and this is the one factor. And another factor is for cases tested positive, and we contacted tested positive, we call, yes, isolation cases. And state system supposed to help to reach out to all contacts, these quarantine cases. And so this will have I feel it's a big discrepancy. I'm not to blame state because state really give us a lot of help, but they are also swamped, and we made yes, little Johnny positive, and he got a call in 1 or 2 days, and his neighbor and our classmate probably will take 3, 4, 5 days. State call them as close contact. This another factor. And another factor delay is really, yes, honestly, it's sheer short of resources for our staff. Our staff already work 7 days a week, and some people, yes, leave at 5, 6, 7 o'clock, and we just cannot catch up. Thanks to Chairman and Phil, and very supportive, and give us additional permission, and we can work over 40 hours, and I want to say start the last week, Thursday, Wednesday, and Thursday, Friday, and we drastically reduced back up. And as of yesterday, they are not today, because today I haven't had a chance to check, and we have about 60 cases back up. So these 3 positions will help us to increase our case investigation outreach capacity. And I know you will say, well, you already give us 2, I think last month, and why we need to add these 3 is because the more work at COVID-19, the more I feel it's unpredictable. And I was thinking, oh yeah, it's going down. I saw 7-day percentage from 6, 7 reduced to 5, close to upper 4%, and then now go back to 7, 8 again. So also, because this in our department internally also have some controversial. Even before I took lunch today, and some staff told me, oh yeah, Jianqing, we don't need this. I said, no, we need it. Why? Is because winter is coming. We don't know what's the situation. And another thing is really, if we can get these people, our people can go more to do more vaccination, and now I will talk about it. Our staff can do more testing. These 3 positions we are desperately needed.
And if I recall, we brought 3 on.
Yeah.
2 completed their training, and then 1 quit. Is that correct? And then 1 more finished their training this week.
Yeah.
Or last week.
Yeah.
So out of the 3, it really ended up with 2.
Yeah, and I think we today we got a new one. Yes.
It's a pretty abusive position. I mean, they're not nice on the phone.
It's abusive.
If the committee passes this, I'd ask you to amend it to include just dash ARPA in the title. We want to include that in everything related to the ARPA funds, so that 4 or 5 years from now, as the audits are being done, can be found very easily with that keyword. So the Treasurer's Office has asked that all the ARPA-related resolutions have that word in them. so that we can follow. That's all.
Questions? Done?
How many positions are we talking now?
Now, currently, I think we have 4, and this is 3 addition.
So we don't have 7.
Yeah, all temporary.
All right.
And this is all funded through the federal funds. It's no cost to the county.
So as the need for them lowers, if we don't get into a big wave in the wintertime, we'll let some of these people go. Is that the plan?
Yes, if we don't need them and they're temporary, and it's much easier to let them go instead of full-time permanent staff. Yes.
Do we have a sunset clause on this temporariness, or can it be temporary for how long?
How long is the pandemic going to last?
It's a good question. It's a very good question. It's a good point. Very well said.
No, this, yes, I think we need a cautious and really what I learned from state. The state have a huge troop of investigators, and they, yes, I think after summer they think, yes, they can relieve it, and they relieve it, and maintain a very thin part. And even 2 weeks ago, I heard they call VCC. They are going to dissolve VCC. When I heard at the NICHO meeting, I said, no, VCC cannot dissolve by December, and we need it. Lulu County, we need them. And now, yes, state realize it and beefing their VCC up.
Legislator Greco, didn't mean to be facetious in making the
No, it's
question.
a good answer.
And I just want to point out, if you look at the budget, this doesn't create specific positions. It funds temporary and part-time line. What that allows the health department to do is if we need these 3 case investigators, well, we do need them now, but say in November, everything declines, he determines he doesn't need them, he doesn't need to call them in. But December rolls around and there's another surge, that line still exists, he can recall those people.
I see. Yeah, that's excellent. Yeah.
So we should do the amendment first. All right, so I need a motion to add ARPA.
I'll make the motion, Adam.
Second. Discussion. All in favor?
Aye.
Opposed? Motion carries. Back to the original. Need a motion?
I'll make the motion, Benson.
Second. Any discussion? All in favor?
Aye.
Opposed? Carries.
Signature.
Much really tired. Pass these down. While he's getting ready, I just want to let the committee know, I made the rounds this weekend on a couple of things. Went to a huge event in Madison County, which surprised me. No masking anywhere at any time. Several hundred people. We came back through Phoenix and couldn't even get through the village. There were several thousand people down on the riverfront that were at that event. And I understand Pumpkin Fest was well attended. So it's not a critical statement, just be aware that this could be part of another surge in this county with the 2 events that I observed here. It's not being judgmental about how they set their events up. Just, these are the type of things that happen, and then all of a sudden you see the big push. Oswego County had a couple of great big events, and a week ago they had some kind of free concert or something downtown, and they couldn't move. And their numbers come back at 300 and some odd people in one day as testing positive, so you just never know when you're going to need these people to fill in those slots and help get things brought back in.
Yeah, this is the graph I like always show you, and you can see this is the most recently, and this is last year from November to this year March, and you can see since later August we're in a high the increasing slope, and a few days it's quite close to our peak, and still we closely monitor who gets the positive testing, and we saw 30% they are fully vaccinated, and another another 60 about percent, and they are not vaccinated or not fully vaccinated, and about 3-4% their vaccine status is unknown. So this is the reality, and the other is really this is the burden, and really our staff work very, very hard. Interrupt me if you have questions. Okay. Page. And this is I wanted to show you school only cases, and you can see school started September after Labor Day, and September 6th, and we have only one cases, and then recently we had this was end of last month, and we had close to 40 cases a day, and usually these school cases occupy a quarter or more of our daily cases, and our cases is mostly related to sports team, and some related to school bus, and some related to school classroom settings. And this is a lot of pressure on us, and it's also, like just mentioned, this abusive treatment in the phone bank, and some people, I have to say, yes, very, very nasty. And our staff, I trust them 100%, and they have been so nice to people. And one afternoon, it's in a vaccine clinic, and a healthcare provider was not happy to get the shots, but if not to get the shots, they cannot keep work, so they just lost temper in our clinic, but our staff still, treats them very respectfully, very well. So this is school situation, and so far accumulative from the whole September, we have 420 some cases from schools. And this is another interesting graph, and you can see this is the yellow is daily, everyday total cases, and the yellow is school related cases, and here this gray curve is the percentage. Here's the percentage, so you can see we could be as high as 58%, and usually if you took a look at here, average is about between 20-30%. So here 30% to 20%.
Excuse me, are you saying 58% of the student population has COVID?
No.
Or are you saying those tested?
Tested positive, not a student. Tested positive, because these are cases, all cases in the community, and these are all positive cases from school. So this is the percentage. Okay. And this is our county vaccine coverage rate, and so you can see a couple number I want to point out. And for age above 65, and you can see quite well, and 82.3% they are vaccinated. But if you look at the eligible population, and this is so far still 12 and above, and we have here 52%. So it's still relatively low, and but this is really very hard to reach, and I'm very thankful to United Way of Greater Oswego, and they ran 3 raffle, and each raffle won iPod and won 250, I think, gift card, and the third prize is $100 movie theater card, and ran 3 months from end of July to end of September, and it really helped a lot to promote the vaccine for young people from 12 to, I think we set up at 22 or 25. So this community collaboration is important and is helpful. Why? Yes, this is our vaccine clinic, and last time I think I show you was end of July, and I said next month we can see number increase, and because this is blue bar is the number of clinics we run, and this orange line is the individuals we vaccinated, and you can see we increased from 200 to over 400, and vaccine clinic number will increase a lot, and started today, and we have in our department calendar every day we have clinic. Monday, Friday we have 4-day walking flu clinic. Tuesday we have school clinic. Wednesday we have COVID-19 walking clinic. So every day is full completely. Okay, let's change another topic of mosquito. And I always report to you by numbers and say, oh, yes, we sprayed, and this spray 85 to 90% effective. Or this time data collected 90 to 95 effective. And this time everybody busy, and I didn't push state entomologist too much, and I didn't track it down what's the number. But very interesting is, yes, I got this picture, and this picture was during the spray, and because when air spray in the air, and federal regulation need a vehicle on the ground help pilot. So it happened just that this mosquito when fly over, and this mosquito drop on the truck, the on the ground coordinators truck, and so they took a picture, and you see, I don't know, this is fully fed mosquito. It's because too heavy drop there, or hit the chemical drop here. This is really the outcome of our spraying, and I always say that, and think about people think, oh yeah, we spray and it's damage to the environment. And I think the reason the 2 years I didn't get an angry call. If I go back to 3-4 years ago, some people very angry. Oh, you made my yard or my table all yellow. And I said, no, it's not yellow. And something spray, and I was under the airplane, open my arms, and nothing on my arms. But people just cannot believe it. It's hard for them to believe. Why? It's because every acre they spray chemical less than 1 ounce. It's they call it ultra low volume. Yeah, and this like this, and this is the way we spray. And by the way, I urge yes, our county keep our mosquito surveillance system, and I want to share some with you. And which county? Oh, Cataract County in West, Cataract County. Yeah, in Western New York, and they had one horse die, and they don't have surveillance system, so they don't know where to spray. So it ends up the same pilot, Mr. Duflo, spray for our county, and he went there last week, sprayed 75,000 acres. Because we have this surveillance system, so we can always spot very specific area to spray, and this is really help county to control the cost. 75, I think probably, yes, the past 5 years added together were less than 75,000 acres. And I remember one is 2014 probably, we sprayed 3-4 times. And added together probably, yes, still less than 75. So this mosquito surveillance system is really very, very helpful for our county. One is really timely warning our residents, and the other is really cost effectiveness. Okay. Oh, this is another environmental health topic, and you can see, and this is water operator training, and state federal government require water operator, public water operator need to get the certificate yearly, and last year because COVID-19 we didn't run. Not we offer spaces, and we didn't, and this year we resume our operation, and these two trainers, and they came to us, and the community needs it, so we opened it up. And originally, because this was planned in June, July, and we say, yeah, it's open. We are open, and our training room we can give you for 4 or 5 days, and they get 40 people came in. And then when this COVID-19 increased, and we said, no, you cannot have 40 people coming all together, divided into 2 groups. So 40 people, they divided 20 people, and this is like less than 10 people, and they got to train. I know, like first 20 people all came from Oswego County inside our county public water system. So this our environment is doing a great job, and yeah, I hope next month we will bring you more info, the outcome about our Super Dirt Week situation. And last time I reported to you our community health program never stopped, tobacco cessation, and this is another one, and another one, and it's going to run from October to November, and 4 weeks, and this Oswego County Healthy Miles, and this is a group agency, OCO, Arise, and Health Department, Fulton Greater Bear, recreational area, and all these get together. And this is really amazing. And COVID-19 still hit us, and our community never stopped working on this. I remember last year, this time we encouraged people, yes, a whole family can go together and without a face mask and go to hiking. This message in the communities was well received, and people like it. And we just remind them, family, keep 6 feet distance. So this is another beautiful piece of our community. Oh yeah, this is our two staff. Jody and Sonia made a presentation at the national national webinar, and our county this COVID-19 response phone bank, and they present our phone bank operation and our phone bank impact to address health equity in our county. And yes, I'm pretty proud that Oswego County is one of 3 was chosen in the nation, and really this. And before I go to our goal and I report some other situations to you, and disease reporting, and other than COVID-19 and increase a lot of investigation, and also we saw other disease increased activity, and gonorrhea, syphilis increased, and this is not just Oswego County, and another counties, they put their statistics, and their syphilis this year, not ended yet, like yes, 3/4 of the year just passed, and their syphilis case so far is already 3 times than last year. And in our county, not that high, but we saw definitely gonorrhea, syphilis cases increase, and also hepatitis C case increase, and this also you can consider it's a STD, but on this side is really, if you think about it, yes, more people tested hepatitis C, and it means our health care system gradually resume, and the people go more to see their doctor and get tested. It's a good thing. And another disease burden put on our community is Lyme disease. Lyme disease, we already, I think I mentioned that in the past meetings to you, and we put a lot of efforts and resources there. And here I brought ticks remove kits, and this year we distributed more than 200-300 of this kind of kits at the community events. And in the kits you can see this is a teaser and repellent and an instruction how to remove a kit, and then this alcohol purple for you clean after you remove it. And so this still, a lot of ticks there, and we still continue work with any opportunity, and work with this our partners like Super Delta Week, and we put the tick prevention and COVID prevention information in their goodie bags, and still these are our community concern, and we keep working on it. And this we're working on our budget, and this is a part of budgetary requirement, and every year annual goal, and we will continue to work on COVID-19 response, and COVID-19 response short case investigation, mitigation, and all testing. These are all included. I'm not going to go through. And another is, yes, we will keep continue to improve our internal operation, improve our efficiency, effectiveness. And the two things I think quite unique we added here is really we already, but we will continue to identify our Department of Public Health infrastructure needs, and I look forward to your understanding and the support, and because this is a good opportunity to build up county public health and with a long-term goal, and we can really improve our county health ranking. And I don't remember I shared this with you or not, and like Rockland County, and this was probably almost 20 years ago when they had this tobacco settlement money, and the Rockland County, they put a lot of money to their tobacco cessation program. And after more than 10 years, yes, their tobacco, adult tobacco use was the lowest in the state. 2016, they're the lowest, I think 14%. And this, sure, it's harder to maintain. In 2018, yes, the first place was replaced by Nassau County, but still, Rockland County is at the top 3-4 in the state. So I really hope your support and put a long-term vision there, and we may not see immediately, but yes, let's work together 10, 20, 15 years, and we will make our county health ranking improve. So this is one. And another one, I added here and state yes, because infrastructure lack, and New York State Public Health Core Fellowship Training Program, and we got 1.8 million for 2 years, and we can train some staff. And really, this is, I said always to our staff and to NICHO, and I say yes, Lulu County, it's harder to recruit and retain these public health professionals, and this is a good opportunity. And I'm working with HR Director Julie Bell, and we will find a way how to get trained and keep them into the county. And I really think if we can get them trained and stay county for 5-10 years, it's good enough, because I hated to see in the past, I think probably 18 months, and I saw at least 3-4 people, yes, they're young, came in and get a job here, and then move to neighboring county or move to national organization. I said, yes, we are a good training camp. We cannot keep people here, but I hope take this opportunity we can keep some people, good people. So these are my presentations. Any questions?
I do have one question. The COVID lottery prizes, are those donated prizes, or how are those purchased?
Oh, this is not, these prizes is not that they donated to us, and they run their lottery, and
Okay, that's good.
yeah,
Fine.
not we.
Yep, thank you.
Yeah.
Anyone else? Go ahead.
You know, Doc, the money that we discussed a month and a half, 2 months ago about COVID money going to the schools.
Yeah.
Did you get a plan from each school?
Yes, we are still working with them, and yes, each school should have a plan, and then we will sign it, and money then go there. Yes, each school should have a plan.
Should have.
Yeah.
Is the communication from the superintendent of each school, are they on board with this, or is there some resistance, or?
No resistance at all. And we did a survey, 9 school districts. Oh, put both these together, 10 school districts, and all 10 school districts, they want screening testing capacity. Screening testing means testing, randomly choose people without symptoms and testing them. And I think 7 out of 9 school districts, and they wanted to have diagnostic testing capacity. This means they want to test either their staff or their student with symptoms. So it's, I think yes, all these school districts, they are well responsive. Not a single school say, no, we don't want this money. No. Every school will participate.
All right, and just one more thing, and maybe I just missed it. You were comparing Rockland County with the percentage of people smoking, and it's 14%.
Yeah.
And you were comparing that, is the reason they're low, or?
No, I compare is because I said they had, when more than 15, 20 years ago, when tobacco settlement money came to throughout the states, and they put quite amount of money to their tobacco cessation program. So because they're long-term planning and they achieve their high payback, put it this way, and their adult smoking rate reduced to the lowest in the state. This is what I try to say.
Yeah, no, I understand, because Rockland County, I'm familiar with the states, I've traveled all over in my career. Rockland County has an extremely high capita family income. They just do, because you're a subsidy of the New York City, but yet the people with real money, and I'm sure you're familiar with it, leave the city and live in counties like that. It's not a very populated county. I don't think they're anywhere near as big as we are. And you're dealing with people from a different demographics. They have more education. Education is a key on anything dealing with drugs or smoking or alcohol and things of this nature. And they have Rockland County has an extremely high educational per family household per person. It's a lot higher than ours.
Okay.
By light years.
Yeah.
By light years.
Thank
So I mean, you got to keep that in mind. That's all.
Thank you. Yeah. Thank you. Thank you.
Anything else? I'll take the appropriate motion.
Motion.
Second.
Anyone opposed?